Well, thank you so much for having me. This is my first time joining a We Act working group, and I'm very happy to present this new paper that is absolutely speaks to the Beauty Inside Out campaign at We Act that was done with We Act and has We Act leader Bo Morton as a senior author on the paper. So I will really just jump right into my results. I do have some slides. I know slides are hit and miss, but I thought it was a good way to share the results. So really today want to share results and then leave time for discussion. So can everybody, is my slides visible? Awesome. Okay. So this most recent paper, Beauty Inside Out, examining beauty product use among diverse women and infant-identified individuals in Northern Manhattan and the South Bronx through an environmental justice framework, was just published in Environmental Justice. As I mentioned, it's a collaboration by current and former folks at We Act, as well as folks at Columbia University, Yale University, and Austin College. So I really want to leave time for questions and discussion, because I feel like this work lends itself nicely to a lot of really deep questions and discussions, on colorism, on beauty standards, chemical exposures, all of the things. And so I'll give a brief background, just enough to kind of get everybody on the same page, although I know this group has been meets regularly and talks about Beauty Inside Out, so you may not need as hefty as a background. So I'll give a very brief background, briefs of information about the study, then really get into some results in context, and really leave time for questions and discussion. And so we're a small-ish group. So if there are questions, you can put them in the chat or stop me. And if I don't see any questions in the chat, Jaron, just flag me and let me know.
You got it.
So really, this work comes out of the idea that, we need to start thinking about beauty product exposures as a form of environmental racism. And this idea that environmental racism is disproportionate impact of environmental hazards on communities of color. So, while we're not thinking about facilities or heavy polluters in neighborhoods of color, it's very much the same thing thinking about beauty product exposures, especially when you really think about the link between, beauty product exposures, the glorification of Eurocentric, beauty standards that highlight and glorify, light skin, straight hair, how that is linked to racism, sexism, white supremacy, colonialism, all the things that kind of are very much embedded in our country and globally. So these Eurocentric beauty standards create a pressure for people of color and women of color to use these products in order to meet these standards. And these products often contain toxic chemicals that are highly unregulated, although it is getting better with this new recent policy that I'll discuss later. But mainly these products contain very, very harsh chemicals that we know are linked to unfortunate health effects that then disproportionately affect communities of color. And so this is largely termed, we think of this framework as the environmental justice of beauty this term was coined by Dr. Amizoda, Dr. Bhavna Shamsunder in 2017. And so what this really means is that Eurocentric beauty standards disproportionately impact women of color and also broadly people of color, who are then marketed and use products containing some of the most toxic chemicals. So Beauty Inside Out campaign really focuses on chemical straighteners and skin lighteners. So when we think of chemical straighteners, we think of products that are used to chemically alter your hair texture, make it straighter. Most commonly used by Black women, they contain phthalates, parabens, estrogenic chemicals. And we know that the use of chemical hair straighteners and some of these chemicals are linked to really nasty health effects, such as uterine fibroids, premature puberty, and endocrine disruption. And then skin lighteners, these products that are used to reduce the melanated pigment in skin, to whiten and brighten skin, often used by dark-skinned folks globally. They contain mercury, hydroquinone, corticosteroids. And these chemicals are, another toxic bunch that are linked to neurotoxicity, kidney damage, and metabolic damage. So these are products that are disproportionately used by people of color. So then as a result, people of color are bearing the brunt of these really nasty health effects. So that is kind of the background and framing of the Beauty Inside Out campaign and of this work. So in terms of the paper we just published, the objectives were to, one, characterize chemical straightener and skin lightener use among the study group. And then two, identify what were some of the social, demographic, and factors and social influence associated with product use. So what factors were associated and were driving product use? Could it have been age? Could it have been place of birth? Could it have been others' perceptions of beauties? What were some other factors that were driving product use? Because if we can understand, what are some of the, what are just a few of the multifactorial reasons that people think about or do in order to use products, maybe we can educate and get them to, use some of these products less, which then reduces chemical exposure and spares for some of these negative health effects. So a bit about the survey. This survey was created by WEAC staff and Yale School of Public Health students. It went through several rounds of edit and feedback through the research team, community focus group, survey administrators, and community informants. And I believe the working group of Beauty Inside Out also had a hand in helping to really finalize and tweak this survey to make sure it was appropriate and relevant for the targeted study population. So a big thanks to any of you who were in the audience who helped edit this survey and make it usable for this work. The survey had 92 questions. It was available in English and Spanish, and the questions were very broad in what they covered. So there are questions asking about product use. So have you used chemical straighteners in your lifetime? Have you used it currently, which meant in the past year? There are also questions about perceptions and attitudes around product use, and also attitudes around light skin and straight hair generally. There were questions such as, do you believe that others find light skin on women to be more beautiful or more youthful looking or wealthy or more professional? So really getting at the sentiments around product use and these Eurocentric beauty standards. So the survey was disseminated by trained community members in March and October and November 2020. The target population were 18 to 45-year-old women and femme-identifying folks. And the survey administrators went and canvassed these neighborhoods in order to recruit people to take the survey. And overall, we had 396 surveys collected. So I think that is great. And that is definitely a huge thank you to the survey administrators and all the folks who made this survey easy to use, appropriate, and very responsive to the people we were trying to get to take the survey. So getting right into some study population highlights. So after I failed to put the total population number, after we eliminated some surveys that were incomplete and some surveys taken by folks who didn't live in those target neighborhoods, we had 297 complete surveys that served as the framework and basis of our analyses. So surveys were primarily completed in English. Respondents were aged 25 to 44 years old. Respondents were mostly identified as female. And respondents, about half of them were born in the US, half had a college degree or higher, and half were single or not in a relationship. Moving on to the racial and ethnic breakdown of the survey population. So about 55% of respondents identified as Hispanic Latinx ethnicity. 31% identified as Hispanic Latinx, but had reported no race. And 23 were Hispanic Latinx Black. Among non-Hispanics, Black was the dominant racial group, and then Asian. And I should note here that respondents were able to select more than one racial group. So in the paper, we also break it down by multiracial group as well, which is a smaller group, but I wanted to highlight that here, that folks could identify as more than one racial group because that is very much a reflection of our country. So getting into the analyses and what we want to focus on for this paper. So as I mentioned, our objective was to characterize chemical straightener and skin lightener use. So for our analyses, we report use by race, ethnicity, we report use by gender identity. We really wanted to see, who are using these products and are there differences by gender identity and race ethnicity. And then getting back to the subjective about understanding what factors or social influence are associated with product use. So was place of birth associated with skin lightener use or chemical straightener use? What about some of these social structural factors? Was the messaging that respondents heard around straight or curly hair growing up, was that associated with chemical straightener use? So these were some of the analyses that I'm going to get into now. So starting with the big picture findings, and then I'll move into talking about results for chemical straighteners and then skin lighteners separately. So these big picture findings, overall individuals surveyed, and it was mostly primarily women of color, as I just discussed. Overall, the respondents were frequent users of chemical straighteners and skin lighteners. Respondents were asked to identify their personal reasons for using chemical straighteners and then separately skin lighteners. And while they could choose multiple reasons, the number one reason chosen by respondents for both chemical straighteners and skin lighteners was beauty. So most people are using these products for beauty reasons. We found that racialized beauty norms were drivers of product use. So this idea that lighter skin and straight hair are seen more preferable, we found that was driving product use, which is, important to understand. We also found that chemical straightener use among our study group appeared to decline, while skin lightener use did not. And so I'll get more into those results next. So first, the results of thinking about skin chemical straighteners. So as I mentioned, chemical straightener use was common, but appeared to decline. Lifetime use of chemical straighteners, which means have you used these ever in your lifetime? So lifetime use for females was 44%, and for female identifying respondents, it was 34%. Then breaking it down by race ethnicity. So this is looking at both females and identifying respondents together. So use was highest among non-Hispanic and Hispanic Black respondents at 60 and 48% respectively, and this was lifetime use. But then when we look at current use of chemical straighteners, we notice that these numbers were lower, so there appears to be a decline. Current use overall was lower, and current use reflects use of chemical straighteners in the past year. That's how we define current use. So among female respondents, it was 15%. Among from identifying respondents, it was 13%. And even among Black respondents, which was the racial ethnic group with the highest amount of skin chemical straightener use declined. So this is why we made this is why our data appears to suggest that chemical straightener use is common, but appears to be declined because fewer respondents are currently using them or have used them in the past year than in their lifetime. One factor that was important in regards to chemical straightener use was messaging. So there was a question regarding, do you recall if your family or peers made any comments about straight hair or curly hair? And the responses are, family and peers express preference for straight hair, express preference for curly hair. I don't recall making comments or mixed, which means family or peers said they express preference for both. So we found in our study that respondents who heard peers or family members express a preference for straight hair were more likely to use chemical straighteners in their lifetimes compared to respondents who recalled that family and peers had mixed preferences about hair type. So this really gets into the idea that personal networks and a person's personal networks and connections can have an influence on the products that they use, which then has an influence on the chemicals that they're exposed to, because we're seeing here that respondents who heard loved ones express a preference for straight hair were more likely to use chemical straighteners in their lifetimes. So getting into some of the results about perceptions. So respondents were asked whether or not they believe others believe straight hair makes a woman look more beautiful. So 50% of respondents thought that others believe straight hair makes a woman look more beautiful, but only 36% of respondents personally felt that way. So respondents personally didn't feel like straight hair makes someone look more beautiful, but more of them thought that other people believe that, which may have an influence on their purchasing or use of products. And these findings were significant. That's what the asterisk means. So we found similar findings with straight hair making women look younger, wealthier, or more professional. So more respondents thought other people believe that straight hair makes women look younger, wealthier, more professional, but fewer respondents personally felt that way. So getting into, are these perceptions driving product use? And we are seeing that, yes, these perceptions are. So respondents were more likely to use chemical straighteners in their lifetimes if they believe that others thought straight hair makes a woman look wealthier or more professional. And these findings are statistically significant. So this gets into the idea right now that racialized beauty norms are driving product use, because respondents who thought that others believe that straight hair on a woman is a sign of wealth or professionalism were more likely to use chemical straighteners in their lifetimes. So switching gears to the results about skin lighteners. So skin lightener use was common and constant, and I'll get into why I say constant in a minute. So lifetime use of skin lighteners was 25% among female respondents and 22% among female identifying respondents. Use among Asian respondents was the highest at 57% for both lifetime and current use. And so, although Asian respondents represent a very small proportion of our entire number of survey respondents, they were the group that reported the highest use of skin lighteners in their lifetime and currently or in the past year. We also found that respondents born in other countries were more likely to use skin lighteners than respondents who were born in the US. And this is particularly true for Asian and Hispanic identifying respondents. And these results are particularly significant. And so why back to the title, why I say skin lightener use was common and constant, because unlike chemical straighteners, where we saw that fewer folks were currently using, that was definitely not the case for our highest group of Asian identifying respondents. They report using chemical skin lighteners at 57% lifetime and current use. So there was no decline like we saw for chemical straighteners. So getting into perceptions, similarly as what we found with chemical straighteners, we found that more respondents believed that others find lighter skin to be more beautiful on women, but they didn't personally feel that way. So 50% of respondents thought that others find light skin to be more beautiful, while only 33% of respondents personally reported feeling that way, and that finding was significant. And we had similar findings for light skin making women look younger, wealthier, and more professional. So more women thought that other people saw light skin as a sign of wealth and professionalism on a woman, but they did not personally feel that way. And getting into also, are these racialized beauty norms and perceptions driving actual use of skin lighteners? We found that respondents were more likely to currently use skin lighteners if they believed others thought light skin make a woman look beautiful or more youthful. So again, we're seeing that these ideas about racialized beauty norms and perceptions are driving product use. So some key takeaways from our results. The use of products was common among survey respondents, both skin lighteners and chemical straighteners, although we did see some variation in product use by racial and ethnic group and place of birth. So we saw that among Black respondents, regardless of ethnicity, chemical straightener use was the highest, although we did see a decline in the current use of chemical straighteners. And among Asian respondents, we saw very high use of skin lighteners, and also we saw high use of skin lighteners among those who were born outside of the US. We also saw that racialized beauty norms are an important driver of product use. Our findings showed that women who thought that others believed that light skin or straight hair affords some sort of benefit, whether that be youthfulnism or professionalism, women who thought that were more likely to use these products. So that really shows that racialized beauty norms are important drivers of product use. And while our paper doesn't really get into all the nuances, it really kind of speaks to deeper themes about internalization of racialized beauty norms that may surface from purchasing products. Many women said that, they didn't personally believe that light skin or straight hair makes a woman more beautiful or makes someone look more beautiful. But, these thoughts and feelings may unconsciously come out while they're purchasing products or, going about their lives. So it was a really interesting result that speaks to a lot of deeper themes around this work. So, putting these results into context. So we saw that chemical straightener use was common, but on the decline. And that result really just fits into a wealth of literature around chemical straighteners, particularly relaxers, in terms of relaxers being very popular among Black women, and also relaxers being linked to adverse health effects. So this is talking about a recent study that came out last fall that linked hair relaxer use to a higher incident rate of uterine cancer among women. So women who were frequent users had double the risk, and frequent user was anybody who used hair relaxers greater than 4 times a year. And this paper about cancer, relaxer linked to uterine cancer, is really just a drop in the bucket of other studies that linked hair relaxer use to other health effects like breast cancers, early puberty. So really there is a wealth of literature that is showing that hair relaxers are not good for our health. And it is encouraging to see that they were on the decline amongst the folks in our study. As we saw among, self-identified Asian respondents who were the highest usage of skin lighteners, there was no decline. 7% of Asian respondents said they used skin lighteners in their lifetime, and 57% said they used skin lighteners in the past year. So the use of skin lighteners didn't really change amongst our highest group. And so I'm pulling out here a few quotes from first CNN White Lies. It's an article series that talks about colorism, the use of skin lighteners, and just pulling some quotes that really echo some of the things we saw in our study. People saying that, with light skin, you're perceived as beautiful and clean, a much better person. With darker skin, you're less likely to be selected for the job. You're more likely to be taunted, teased, and looked down upon. And I cited the Pew Research Center in our article, which surveyed Hispanic Latinx individuals in the US, and just highlighted the idea that a lot of Hispanic Latinx folks in the US believe that having darker skin really hurts their ability to get ahead. So again, these results kind of echo some of the things that we saw in our paper, this idea that so many respondents thought that others believe that lighter skin, some respondents thought that others think that lighter skin makes women look more beautiful or wealthy or professional. So just wanted to highlight some common themes and put these results into context. And thinking about these results and what can be done. So policy obviously has the potential to really create change and create impactful change, although it takes time. So I highlight the Crown Act, which is Creating a Respectful and Open World for Natural Hair. It's a law that prohibits race-based discrimination in the workplace and at school. It's passed in 18 states, including New York. I highlight the Crown Act here because I think it's a great example of policy that fights discrimination, but also helps to change the narrative around hair. One of our results highlighted that messaging from family and peers about hair was associated with chemical straightener use. And I can imagine that, if the Crown Act makes discrimination for your hair at school and work illegal, maybe that'll have like a trickle down effect. So that narrative and that idea that you have to have straight hair to be seen as, beautiful or professional will start to go away. And maybe that could potentially impact the messages that that family and peers were given to survey respondents that compel them to use these products. So I wanted to highlight the Crown Act as an example of something that could, actively fight discrimination and also could help potentially change the narrative. And it would be wonderful if there could be something like that for, colorism and skin lightening products. Other important policy that I think that is great and speaks to this work is the Mercury Out of Cosmetics bill that was signed by the governor of New York in December 2022, which bans the sale of products containing mercury in stores and online. That definitely has the potential to really help keep potentially New Yorkers safe from these products that contain mercury, which is very dangerous. And also the most recent Modernization of Cosmetics Regulation Act. This is the first time that a federal cosmetic law has been updated in over 80 years. And I'm not entirely familiar with the ins and outs of the laws, but I do know that it's a step in the right direction in terms of protecting salon workers, because when we think about the environment and justice of beauty and the concerns around that, it's not just people who use these products at home, it's also salon workers who are often predominantly people of color, women of color, who are using these products for, their day job. So that's 8+ hours a day. So that's 40 hours a week. And they're constantly being exposed to these products as they're using them on people. So this new FDA Modernization of Cosmetics Regulation Act has a potential to really protect them. But it's a step in the right direction, but it still doesn't solve all the problems. There were some areas where it could have had a stronger effect to protect women of color, and we're not quite there yet, but it is progress. So, what's next? I feel like a lot of the work from our most recent manuscript points to this idea that racialized beauty norms are driving product use, absolutely. But how do you change, decades of, socialization that US beauty standards are the goal, right? How do you change that? And that's an impossible question to even think about, but I feel like the best change starts with education. So the folks who helped with this paper and in collaboration with we have several education focused research projects coming up, targeted at communities of color and adolescents, to hopefully help them make this connection between colorism, natural hair discrimination, toxic beauty and personal care products, and their health. If we can get them thinking about this, and maybe we can potentially change the relationships to these products, which then reduces their exposure and potentially their risk of negative health outcomes. I also look forward to being a part of investigating these same questions with the Children's Surveys and Beauty Inside Out campaign, which I know is still ongoing, but I look forward to potentially digging in that work as well and having those findings to share and publish in the future. So I have a very, very long list of acknowledgements, starting with the folks at Columbia and GW who help with this work. Obviously, the WEAC team, this work would not exist without. Want to highlight that Alex did a great job making the fact sheet, and I kind of stole his design for my slides today. So thank you for that, Alex. The Yale team that helped with this work, our funding sources, and of course, really all the community members who took this survey, who helped make this survey what it is and help make this work possible. Big thank you to all of them. We wouldn't have this work without them. And I will stop here and I will take any and all questions.
Thank you so much for that, Lariah. It's really good overview and really captures so much of the work that has been done on this. And we did have some great questions in the chat. And I think that we'll start with, let's see here. The first one, which was, were there any key nuances between the results of millennials versus Gen Z respondents?
That's a really good question. We didn't dig as much into age, although we didn't really find that age was a driver of product use. So when we were looking at, age was an associate with product use, really. We were looking at what factors may be driving product use. I don't recall age sticking out as being a big factor associated with product use, but that is a really good question. I'll read the next one. Were there any questions in the survey that asked people who use them? Yes, there was. So the Beauty Inside Out survey had 92 questions, and the most recent publication probably only touches on a fraction of those questions. So I should have highlighted in my what's next slide is that we can continue to dig into the survey results and pull a lot of different information. I recall there being a question of, do you read product labels? Are you aware of negative health effects? And it was maybe only a third of folks say they read product labels, and not many folks saying they were aware of the negative health effects. I don't have the exact numbers on me at the moment. I can get back to you about that because we do have that data, but it wasn't, I can say that wasn't a very common response, that people were aware of the chemicals in these products, that they were harmful. And they also didn't overwhelmingly read the product labels. So I think that points to education as a way to intervene there.
Good evening, Dr. Edwards. This is Bailey from WEAC. I'm the manager of membership. I put a question in, but I always let members speak first. I'm looking at was it in the survey regarding the media, which plays a big part in the magazines like Vogue and all of that. Was that one of the questions? Because I think that's another driver, you know, especially television. You're tall, you're thin, you're light skinned, you got long hair, and those are the type images, if you can constantly see them, that might be a driver for, let's say, a young person who's like 11 or 12, just coming into their own. It's like, oh, wow, that's beautiful. Was that one of the drivers, or was that even asked in the survey?
So that was a question that was asked, and that I was asked in the survey that we didn't include in our study. There was a similar question. It was asked where you purchase your products from, and one of it was like, I purchased the products based on influencers and social media. And so we didn't include that in our analyses, but I think you're absolutely right. That is a huge, it's a huge driver of, you know, why people are using these products, why, and how to intervene. And some of the work that I have coming up, where I will be attempting to educate adolescents about that, I'm going to lean heavily into social media, into TikTok, and I'm going to, you know, use it as an example of, you know, TikTok, social media is reinforcing these university beauty standards and creating these pressures. And they also can spread misinformation about clean products, you know, brands being clean and things like that. So that's a very good point to bring up, and definitely highlights that there's still so much we can do with the Beauty Inside Out survey results.
And then also just one quick, and then I'll turn it over to LJ. Television is now 24 hours. When I grew up, it went off at 1 o'clock. So now you have 24-hour access to this information that you normally, when it went off, I remember it went off like 1 or 2 in the morning. That was it. So
yes, absolutely. There is so much that could be said about the marketing and the media and its relationship to product and driving product use. LJ?
Yeah, thank you so much for that. I have one question, because I'm very interested as someone who identifies as a man but has grown up around with lots of women and sisters around. I'm interested and curious about like what like the survey or like what the results might say about generational youth and just kind of like cultural use of products, right? And like, I guess you would say, I guess you could determine it's like the internalization of some of these beauty standards and like how these kind of traditions are passed down, like going to the beauty shop or watching my mom do my sister's perm. And like, you know, I'm sure her mom did the same thing. Like, I'm just wondering like what, you know, if there's anything that has come out of the study that has touched on that a little bit.
Yeah, again, those are questions that are in the survey that we haven't got to tease out. I'm thinking in particular, there were questions about respondents who have children, who then do you use these products? Do you use these products on your children? So that then gets to that generational, kind of strictly generational, like, do you use this on your products on your children? In terms of really teasing out the, you know, the generational use, I don't think there were specific questions that kind of speak to, you know, do you use these products because your parents did, or because your family did, or because it was like a cultural thing. But I think those are also incredibly important questions that play a big role, because I remember my mother chemically straightened her hair. She chemically straightened my hair. I would identify as like an ever user in the study, because I used them. I've been used them in my lifetime because my mother put them on me, and that's just what I knew growing up. So yeah, that's an absolutely really important concept that needs to be discussed.
I also want to raise another point, you know, connected to the study. Usually in African-American communities, the beauty shops which are not owned by African-American, a lot of the Asian population have those, whether it's in the Bronx, I used to live in Harlem, in Brooklyn, they're proliferated in the community and they're selling everything from straighteners to hair and everything. And I think having, 20 of them in Harlem alone is just really pushing that same message out, over the years. It's really, it's tough to see. That's all I'm going to say about that. I'll leave it there.
Absolutely.
I would like to add, I found your, first of all, my name is Yua Voss, but I don't know if you can see me. I'm on an iPad. And I thought like a lot of the results were I know they can help me in my advocacy, which is what we're planning to do on the federal level here at We Act.
That's great.
Especially like having something to show that, this is prevalent in, as how we think it's prevalent in our visioning, our advertisement, what we see in it, and just always bombarded with every day. And going back to what you said about the Modernization Cosmetics Regulation Act, I just want to add a little bit about that. But as you said, it is the first form of regulation, but right now is a big push towards regulation of beauty. The FTC is also, the Federal Trade Commission is also accepting public comments on the revision of their green guides, which has not been revised since 2012. And that basically tells marketers how they can advertise products and what they can say so that the consumer is not misinterpreting the product as being clean or organic when it's not, because certain things, like it may be clean, but the way you're moving it or transporting it may not be clean. It may be not have a certain product, but it has a substitute that's just as harmful.
Yes.
So, and MOCRA would allow the FDA to have some form of authority with the recalls. That's the biggest thing.
Yeah.
So, right now the space is prime for, getting these toxins out of beauty products, especially on the regulatory level. And I was talking with someone about this, but I just finished a summit with the Black fashion, like Black Heritage or Black History Month, with Harlem Fashion Row, which is Black owned and Black sponsored. And one of the panelists said something that I love so much. She said that, we talk about this all the time, we advocate on it all the time, but the way to make a difference is if we start to really inhabit the space. We have to have more Black chemists. We have to have more Black distributors. We have to have more Black manufacturers, because Black people in general are the biggest purchasers of beauty products. I mean, it's like we're the 75% of their billion-dollar industry. So if we actually would take more power in how, in building these companies and having the wherewithal to build these companies, we can actually start to make and invest in products that we know are healthier for ourselves. Because even though there is $1 billion in Black and beauty in general, not many are going to minority owned companies. You don't even see them on the shelves.
Mm-hmm.
There has to be the 50% pledge to even get them out there. Or like Target will make these claims like, we're giving you 5 million over 5 years, which actually equals like 0.1% of revenue. So it's very important that, this study and that reinforce like what we're saying is out there, so that we can like have numbers, we can have something concrete and tangential to show to regulatory agencies, like, this is not what we're thinking, this is what we know to be true.
Absolutely. And if I can help package these results in a better way for your efforts, please let me know.
Oh, I will. You will be called upon in March.
That's good. Michaela?
Yeah, that was a great presentation. And I had read the paper recently. I really enjoyed it. But I had a question because I had heard today through the grapevine that the cosmetics industry had done like a rebuttal to your paper. So then that made me really curious. What's the current landscape for this type of survey? Was this like the first of its kind survey, or have you seen other groups that have done similar things in other places? Yeah, just to hear a little bit more about that.
Yeah. Yeah. For context for the others, the cosmetics design publication covered the study, and then they interviewed the industry trade group. I think the Personal Care Product Council industry. It's a trade group that represents the interests of personal care product companies, and they basically kind of dismissed the study and basically dismissed the influence of social structural factors on product use, and that came out yesterday. To answer your question, I don't think I've seen similar surveys asking these types of questions, at least all in one place. I think when I was writing the discussion section where, you usually point to other papers to say this is how our results compare and whatnot. There are some studies here and there that talk about use of skin lighteners among different racial ethnic groups and why they're using that. But I think this is a very comprehensive survey that talks about chemical straighteners and skin lighteners, which really is kind of like the crux of the Eurocentric beauty standards, right? So I think that is what makes this survey stand out. I am a bit surprised that they saw that and that rebuttal came so strongly. It was very clear that that trade group was in their feelings about this. And that was a bit surprising. But I also think it's a sign that this work is impactful and it's getting the right people's attention. And, I love that. And I think a couple of folks who are in this beauty justice space are considering writing a letter and kind of addressing some of rebutting their rebuttal. And I think they also made some grander claims about what the Modernization of Cosmetic Regulation Act is going to do in the future in terms of transparency. So we want to rebut on that as well. But honestly, I was surprised that that article came out. It's a very weak piece. So yeah, I look forward to writing a response.
Yeah, I think it's a very good sign that they wrote that. It's,
yes.
And Dr. Edwards, I'd like to chime in. About 4 or 5 years ago, I participated in nothing compared to what you're doing here, but we wanted to ban alcohol ads in the subway in New York City, and we got it banned. But they hit back saying, oh no, kids are not influenced. And we had all the data. Kids are riding the subways, going to school, work, it's in our communities, and we got the ban. So to sum this up, a hit dog barks and you hit them right where it counts. And that's why they responded, because if it wasn't relevant, they wouldn't respond. So, that's all it is. We did it. They had to push back again with the subways, because that alcohol ads were in there all over, beer, wine, you name it, in our New York City subways. And now they've been banned from that. So great job on this study.
Thank you. Yeah.
Serene.
I just wanted to, it's not really a question or comment, but I just wanted to say, thank you for doing things like this, because it's very relatable. And I also feel like social determinants of health are not taken as serious as they should be. It's like so much goes into, health outcomes, and we suffer a lot, African-American people, from all these different health disparities because of like social determinants of health. So I just really appreciated it, and it was really, really relatable.
Thank you. Yeah, I agree. I love that this kind of work is really finding its place and becoming something people talk about, because you're absolutely right. It is such a big, important part of our health, and it needs to be discussed and addressed as much as possible.
So I know that we are just right at our time now, and just for the sake of respecting people's other commitments, we'll go ahead and start wrapping up. And I don't know if Lariah, if you have any closing comments, I want to give you the last word here today. So if you want to go ahead and give us some words of wisdom before we go our separate ways tonight.
Oh, I just want no real comments. Just wanted to say thank you. I put my email in the chat if you have any other questions about the paper or the work, or if you want access, well, the paper's open access. So like if you want me to link the paper or the fact sheet, I'm happy to, but thank you for letting me join the group today to talk about this work. And thanks for the engaging conversation.
Absolutely. And with that, I'll thank you all for your time and attention and for joining us tonight. I posted a link in the chat as well for the link to our website for our Beauty Inside Out campaign, which includes information about the youth survey that is still going on. So if you know any youth in Northern Manhattan or the South Bronx who you think would be interested in participating in the study, please share it and allow them to participate in science and helping us move this work forward. But with that, I'll thank you again and wish you all a great rest of your night.
Dr. Edwards, you got your message out first. That's the best part of messaging. You got to get your message out first.
Fair point. Good night, everyone.
Good night.